Good morning, ladies and gentlemen. My today's lecture will be a short one, and this will encompass a recent drug, Upadacitinib, which is marketed and propagated by several pharmaceutical companies as a novel agent for the treatment of adult atopic dermatitis. So I thought that it would be nice if I give you a little update about this drug as well as the JAK inhibitors. I am Professor Ashar Ahmed Mashood, and please subscribe to my channel if you are hearing my video. What is Upadacitinib? Upadacitinib, with the trade name of Rinvoq, is an oral second generation selective Janus kinase or JAK inhibitor. It targets specifically the JAK-1 enzyme and suppress the immune response as is done by other JAK inhibitors. FDA has approved Upadacitinib in January 2022 for the treatment of moderate to severe atopic dermatitis. Uses. So, since the drug is marketed to dermatologists for its use in atopic dermatitis, let's discuss this use as the prime use of this drug. And this drug is indicated for refractory moderate to severe atopic dermatitis in adults whose disease is not adequately controlled with other systemic therapies, or if those therapies are inadvisable because of the medical conditions. Upadacitinib is used for adult and adolescents, that is 12 years or above, and usually less than 65 years. It can be used as a monotherapy or in combination with other therapies like topical corticosteroids. The usual starting dose or the drug is available in form of tablet, which is 15 milligram. The dose is 15 milligram per oral daily initially. And after 4 weeks, if you don't find the response adequate, then you can double the dose to 30 mg daily or discontinue if adequate response is not achieved. Once the response is achieved, the drug should be kept at the lowest effective dose to maintain the response. Several clinical trials have shown that more than 75% improvement in Eczema Area and Severity Index, EASI, from baseline to week 16 of the use of this drug. So once you give the drug to a patient, at least you should wait for its response for 4 months. Other uses beside atopic eczema is rheumatoid arthritis, the psoriatic arthritis, and the ankylosing spondylitis, non-radiographic axial spondyloarthritis, and ulcerative colitis. And this drug is being used in these indications. Contraindication. Concurrent use of other immunomodulating drugs, such as other JAK inhibitors, cannot be combined with Upadacitinib, and same applies to other biologics and potent immunosuppressants like azathioprine, cyclosporin, and tacrolimus. It is contraindicated if patient has developed a previous hypersensitivity to Upadacitinib. It's also contraindicated in breast feeding and in pregnancy. In pregnancy, it is categorized as the category D drug, and it is found to be teratogenic and present in breast milk in animal studies. However, no human evidence is present to date. This drug is contraindicated in severe hepatic impairment, that is, in child Pew store grade 6, grade C. Active or serious infections like tuberculosis, hepatitis B, or hepatitis C are also contraindication for this drug. Precautions. Patients with risk factor for thrombosis, for example, past history of thromboembolism, obesity, or prolonged immobilization carries a relative risk, and the drug should be used with precaution and with thorough thrombotic profile. Then elderly patient greater than 65 years, the drug should be used with precaution because of both the increased chances of thromboembolism and cardiovascular risk factors. It should also be used with precaution in pediatric population, although there are several case reports of its use in pediatric patients. However, the approval of FDA has not yet been given for its use below 12 years of age. In severe renal impairment, that is creatinine clearance less than 30 ml per minute, it should be used with precaution. Then, when it's co-administered with other cytochrome P3A4 inhibitors like ketoconazole, itraconazole, or clarithromycin, or cytochrome P3A4 inducers like rifampicin and phenytoin, it should be closely monitored. Consider the risk and benefit of starting upadacitinib in patients with known malignancies. Ensure effective contraception during the therapy and for at least 4 weeks post-treatment after stopping the drug. Consider the need of immunization prior to commencing the upadacitinib. The live vaccine should not be given during or just before starting the treatment. The dosing. As mentioned before, the usual dose of upadacitinib is 15 milligram, which is the strength present in the tablet. It is a modified release oral tablet. And the dose for adult patients of atopic dermatitis, or the usual dose, is 15 milligram once a day. If the response is inadequate after 4 weeks, increase the dose to 30 milligram per day. In elderly more than 65, in severe renal impairment with creatinine clearance less than 30 ml per minute, don't exceed beyond 15 milligram once a day. Investigations before starting the drug. These investigations hold true to all the JAK inhibitors, and these include complete or full blood count, the clotting profile like PT-PT-TK, then ECG, kidney and renal function test, fasting lipid profile, and tuberculosis screening by IRGA and chest X-ray, hepatitis B and hepatitis C, and pregnancy test if relevant. Once you have started given the drug, then these tests are repeated 3 monthly, which include full blood count, the liver function test, and lipid profile, and ensure the routine skin examination because of the increased risk of non-melanoma skin cancers. When the treatment should be ceased. If the hemoglobin drops to 8 gram per deciliter, when absolute neutrophil count drops to less than 1 into 10 to the power 9 per cells, or the lymphocyte count drops to 0.5 into 10 to the power 9 cells per liter. If there is any sign of active infections like reactivation of herpes zoster, and the increased risk of serious and opportunistic infection while the patient is on treatment. Benefits. Benefits of upadacitinib are its availability in oral form, once a day dose, rapid onset of action, and high level of skin clearance, itch improvement, and improved quality of life in patients with moderate to severe atopic dermatitis. I would like to add my personal experience here that in case of such resistant atopic eczema, the usual drug which I use to prescribe is cyclosporin. And as far as the cost and side effects profile of these two drugs, that is Upadacitinib and cyclosporin, is considered, Upadacitinib is cheaper, as well as it is have less serious side effects as compared to cyclosporin. Disadvantages of Upadacitinib: need to consider multiple drug interactions, which I've already mentioned. Careful monitoring with routine tests is required during the treatment. There are risks of serious infections in selected patients. Not safe for pregnancy and breastfeeding. Cyclosporin is safe. Immunization with live vaccine should not be given during or just before starting the treatment. Side effects. Upadacitinib is generally well tolerated with favorable benefit-risk profile. Common side effects are upper respiratory tract infection like sinusitis, pharyngitis, and tonsillitis. And then the muscle cramp, pain, or stiffness, nausea, fever, cough, headache, abdominal pain, weight gain, hypercholesterolemia, acne folliculitis, and some blemishes. The serious side effects include cancer and immune system. Upadacitinib may increase the risk of certain cancers like lymphoma, and other skin cancers can happen. Current or past smokers are at higher risk. Limit amount of sun exposure while on the medicine and use proper sunscreens. Cardiovascular event. There is increased risk of major severe event such as heart attack, stroke, or death in people who are more than 50 years of age, or those who have at least one cardiovascular risk, especially smoking. So it is better not to give the drug in patients above 50 with a history of cardiovascular illness or a cardiovascular risk factor, which include diabetes, hypertension, obesity, and smoking. Blood clot. Blood clots in vein in legs and lungs and arteries. This can be life-threatening and cause death. So in any patient in which you are prescribing the drug, PT and PTTK should always be done. So thank you very much for the patient listening. I hope this brief lecture was of benefit and you would be now in a better way to monitor as well as prescribe the drug to the patients. Thank you very much and have a good day.